Hi everyone, Shan Orthopedics here. So this is going to be a continuation of my earlier video. I'll be focusing on knee replacement surgeries. You can watch this video with Bahasa, Tamil or even Chinese subtitles. Just click on the captions option available. When we talk about knee replacement surgery, what we're actually doing is to replace the damaged part of the knee joint and replacing them with a metal. Now this is an alloy metal, they don't get rusted or whatnot, so don't worry about that. But we would like to reserve these options only in cases like in stage 3, which is not responding to the usual treatment, or in stage 4, where we'll definitely advise this as one of the main treatment to consider. Now the reason because why we only reserve this to certain stages in stage 3 that doesn't respond, or in stage 4, is because the metal that is being used does not replace the biological bone. There is what we call as lifespan of the metals being used. This is typically about 15 to 20 years, but if you were to do surgery in, let's say, stage 2 for example, then this is definitely going to be an overkill, because you're probably in the very early part of the disease, probably you're younger, and when you're subjected to such a surgery, you will notice that you might need to go for a revision surgery, which is something that we try to avoid. And this is why it is very important to understand what is the optimal treatment for each of the grading of the knee joint. So as I mentioned in my previous video, the mainstay for all these stages of the knee joint, the damage of the knee joint, is still physiotherapy, where you focus on building up your thigh muscles, your quadriceps and your hamstring muscles. The second line will definitely be medication. Do not have the impression that even after you have replaced your knee joint, you don't need to do physiotherapy, you don't need to take your pain medication, because this is still part of the treatment. Of course, the need for the painkiller will drastically reduce after the knee replacement, but physiotherapy is still a mainstay, because you want to make sure your knee is stable, thereby you can improve the longevity of the implant being used. Subjecting to early knee replacement such as in grade 2 is not advisable, like I said, because the lifespan of the implant is about 15 to 20 years. We don't want to have an early damage to the joint or the replaced part of the joints, and thereby subjecting you to a repeat surgery later. So the aim is definitely to have a single surgery, a surgery that benefits you, a surgery that minimizes the complications. So in the next video, I'll be talking on the different strategies taken by the surgeon when they do a knee replacement, so stay tuned for that.